It is 7:30. You're tuned to AM 1240 KASO, Minden, Louisiana. It's time for another version of the program known far and wide as On Call with Dr. Michael Ulich. Doctor is in with us this morning. Doc, welcome back to KASO Radio.
Thanks, Jess. Thanks for having me back.
Good to have you back.
Good to be here. Good morning, everyone. Obviously, it's May 10th, and spring is here. And I'm gonna open up the phones early today.
Yeah.
If no one calls in a few minutes, then I'm gonna go on a few topics. And I want to give a shout out to my parents who've been down visiting for the last 6 weeks, and it's their 50th anniversary tomorrow.
Congratulations!
And actually, heading back up to New York. My little niece is a little sick, but she's getting better, so we're gonna go up and visit her there. So if she's listening, hope you're feeling better, Lindsay.
All right. If you have a question concerning a health-related matter that is a concern to you, call the live line, 377-1244, 377-1244, and the doctor is in to answer your questions this morning.
All right. While we're waiting for someone to call in, I do have a couple topics that I'd probably like to talk about today. One of them is healthcare costs, and that is a big issue going on in the government, locally, nationally, regionally, and What happened with the Affordable Care Act a few years ago is that a lot of families are now seeing high deductible insurance plans, where up to $3,000, $4,000, $5,000, $8,000 of really the first $8,000 of your money every year is going towards healthcare. And usually, that's sick visits and maybe some well visits, but really depends. So you have a lot of people that are obviously on a tight budget, and if you're not a multimillionaire, or even if you are, $8,000, $5,000 is a lot of money to anyone. And on top of that, you're still getting a lot of money taken out of your paycheck, either by your employer or if you're self-employed. Obviously, that's cutting into your margins there. So there are some plans that people and doctors are really trying to come across. We can't really fight the insurance companies too well because they have a lot of power and lobbyists. And so the doctors have come up with, and not too many around this area, usually in bigger cities, something called a concierge service. And what a concierge service is, someone that has a high deductible for their family or their children. And how it works in my specialty in pediatrics, obviously, usually the whole family is covered with Blue Cross Blue Shield or private insurance. Now, if you have Medicaid, Medicare, obviously that's a state and federal, and really it's there's no fee for service, so you're pretty much covered, but you are limited sometimes to which doctors you can use. But you're also limited sometimes in out of network or in network when you do have private insurance through either the state or you're self-employed or your employer. So what we're coming up in Minden Pediatrics is a concierge service for our children. And so, for example, you have a family of 4, and they have a $5,000 deductible for the year. So what we plan on doing is, and let's just say their premium or getting taken out of their paycheck, maybe $400 or $500 a month, and then their employer is paying the rest. So what we do at Minden Pediatrics is we say, hey, get your child a catastrophic plan. And what a catastrophic plan is a lot cheaper. It's probably $50, maybe $100 per child per month. And that will bring down your premium. Then what you do is it's kind of like a club. I hate to say a club, is where you'll pay your doctor, my office, a fee monthly, okay? And what that monthly fee does is that gives you access to unlimited sick visits to your doctor's office for the year. Usually there's one visit, depending on the age of the patient. Usually over 2 years of age, you only need an annual visit, 2, 3, 4, and then, until you're out of the house. And then, so what happens is usually the catastrophic plans will include a one visit a year for a well child. And if your child is not very sick and don't have any chronic conditions, you can actually pay anywhere from $40 to $50 a month for this service at the doctor's office for your child. Now, adults are usually more expensive, but if you run the numbers real quickly, it'll save people with high deductible insurance or cash pay people that have no insurance but don't qualify for the Affordable Care Act or can afford insurance on themselves. Will actually save them anywhere depending on what their plan is, anywhere from $3,000 to $5,000 a year. You get the catastrophic insurance because obviously I don't own a hospital, and if your child breaks their leg or is in the ICU or needs emergency room care, then you're going to at least be covered there. Now that year you're going to have to pay that high deductible, but you plan for severe accidents, and you have your backup there, so you're not going to necessarily have to mortgage the house if your child, goes in the hospital. But you also will save, thousands of dollars a year in premiums and deductibles. So you should really talk about it with, even if you're your family practice doctor, if you do have a high deductible, or like I said, a cash pay. And it's a pretty good plan. It's actually being put in place in a lot of bigger cities, but you can do them in small towns. And we're trying to implement that at Minden Pediatrics over the next couple months.
The penalty for not having insurance has been removed from the Health Care Act. It will take effect. And how's that going to impact things now? Because I don't know how much the penalty was or would be. It still might be cheaper than having to pay for insurance. I don't know. But
right.
How's that going to affect folks that won't have to be required to have health insurance?
Yeah, that is going to save people money, but it's like anything else. You're going to pay now or pay later, and if you get that broken arm or go to that emergency room visit, to really, in general terms, to sign your name in the emergency room is probably $250. Then you got lab tests, the doctors, this. A regular ER visit can cost up to, that's not anything major and no admission, can range about $500 to $800.
There are people that go into those places with problems, but they don't have insurance, and they have no intention of paying.
Yes, well,
let's be honest.
That is a big problem.
So who's going to get stiffed here?
And exactly. So what will happen? Who will get? I hate to say stiffed. What will happen is usually the hospitals will apply for emergency Medicaid, or they will get deductions from the federal government for basically taking care of indigent people. So the hospital will get some pay, but what happens in the long run, it trickles down and premiums go up, because who's going to pay for that is the people that are paying through the Affordable Care Act or private insurance. So I disagree. Obviously, you ask people to pay. You don't want to make them pay insurance, but in my opinion, I think everyone should have catastrophic insurance. If you don't believe in socialized medicine, because it is expensive, regardless. Even if you got rid of the indigent people that use the ER and don't pay a thing, I believe catastrophic insurance is, and what also causes increased insurance is medical malpractice. It's really. It's an awful thing that most of our healthcare dollar actually does not go to the doctors, does not go to the hospital. It actually goes to legal fees and also administrative costs. And that's really the key. And there are, for example, I take 12 to 15 different insurances. There is almost a different code for every insurance plan out there. They call modifiers. So they just, for example, there's a 99213 code. You guys don't need to know what the number is. But one insurance plan says you have to put a modifier in, which you mean you add another number. But the other insurance company doesn't require that. Even for the state Medicaid, which I use, there are 5 different Bayou Health plans. They all work differently. Some will pay for one procedure or a visit, another will not. And I've had a bone to pick with the state for years, because I sign a Medicaid contract, and that Medicaid contract says I have to treat every patient the same. Now, if you have a Blue Cross Blue Shield patient versus a CAS patient, obviously I'm going to do what's best for that patient at that time. But if they can't pay for something and the insurance isn't covered, and I say, listen, ma'am, you really need this shot. Your child needs this shot. It's $10, $20 because that's what it cost me. I can charge them that. I can't charge a Medicaid patient. And that's for good reason. So I don't mind that. But what I mind is all my money in administrative costs is my office manager and my assistant office manager chasing these codes. and codes and codes and codes. And that's really where a lot of, like we said before, comes in. It's not the fee that you're paying or the insurance company is paying at my office. It is actually the administrative costs. And then what happens, even in private insurance, is because private insurance bases their codes on or their reimbursements on CMS, which is Medicaid. So, for example, let's just say Medicaid's going to pay $100 for something, okay? So what will happen is Blue Cross Blue Shield will come in and they'll say, well, we're going to pay $150, okay? But in reality, they're only going to pay $110. So what the doctor has to do to get the cost, they actually have to inflate the bill to $150, $200 just to get a baseline cost. It's absolutely ridiculous.
I thought the tax laws were confusing. This is a
Oh
mess.
no. The tax laws are probably one centimeter above these laws. It is absolutely, you cannot come out of school, and let's just say you go to school for medical assistant or office manager. There's no way you could come out and figure these codes out it'd take you a couple of years to figure them out,
It sounds like we're going to a long way around the barn, be right back where we started. Before
I
we
agree.
try to do
I
something.
agree. I agree.
People are going to pay more for those that don't have the money to pay.
That's right.
And the cost is going to keep going up, and somebody's going to be getting some fat pockets somewhere. down
Right,
the road.
right. And how insurance companies base rates is how healthy your state is, legal, who gets, who sues the most. So they incorporate that all, and they also do is because they have these statisticians that say, all right, this is how much let's just say Blue Cross Blue Shield of Louisiana, this is how many patients we have, and this is what it costs us. So if the costs go up, the premiums go up, so they're still going to get the same percentage of profit no matter what, and the customer's always gonna have to pay for it. And like we said before, as people are more indigent, the hospitals, the doctors, they have to up their billing to pay for those people that can't pay. And it's really not fair to anyone. And to poor people, indigent people, middle class, hardworking people that want to go out and get their own insurance even. And, they make $40,000, $50,000 a year. They got a $7,000, $8,000 deductible. Over 10% of their annual salary is going to their deductible, plus maybe a $600 or $800 premium a month.
You never get to use it unless you really have a major issue.
So guess what happens? What have we talked about the Affordable Care Act? The whole point of the Affordable Care Act was preventative medicine. And say, all right, you know what? That person better go get their blood pressure checked once or twice a year so they don't have a stroke and wind up in the hospital. Okay, but when you have these high deductibles and you can't go to the doctor's office because you can't afford the deductible, guess what? You put off health care. You put off health care until the point of you having a stroke or a heart attack or high cholesterol or psychiatric problems. You're putting it off because you're like, oh my gosh, I'm going to go to this doctor's office and I'll have to pay $200 for this visit. And because it's the beginning of the year, or you're not going to necessarily use $5,000 or $8,000 worth of deductible unless you get really, really sick. Mm-hmm. So it caters to the insurance companies, and the insurance companies are businesses. And that's what people have to really realize, and I know they do.
That's why they exist, is to make money.
And listen, doctors' offices are businesses too, but I mean, I probably do a lot better than a lot of people in this town as far as my salary. But if you look over the years, doctor salaries have gone down and down and down and down. And it's I'm not complaining about it. I love my job, but it's really I'm seeing it actually as these younger medical students come out and doctors, that commitment is not there anymore. And what drives people, right? Your desire to do a good job and to get a decent salary, what you think is worthy for the cost that the time that you put in. No one just because I'm a doctor, I should make this amount of money. No, you need to be a good doctor. Insurance companies have these ways of evaluating physicians, but it's really it's not a very it's an awful way to do it, and it really the doctors are caught in the middle. and the AMA, which is the American Medical Association, which is basically the union kind of for all the doctors. Well, they have a lot of these what I call doctors that are up in their ivory towers, up in these major medical institutions that are making these decisions for private office businesses, doctors' offices, and it's absolutely killing us. It's absolutely destroying us.
You know, you pointed out something. Back when all that was going on in Washington, the debate and the votes and the rhetoric, the AMA was eerily silent.
Yes,
through that whole process.
And don't quote me on this. The AMA membership has gone down, I think, 40 to 50% in the last 15 years. I am not an AMA member. They do not represent me. I have a local chapter here that does the best they can. The AMA does not represent the average practice owning or small clinic or even big clinic in this country. It is absolutely a travesty, and they wanted $500 to $800 a year for a membership, and I have not been in for almost 9 years now because they don't represent me. They don't represent the doctors as a whole, and it's awful. And you know why? Because of those lobbyists up in Washington. And they, if the AMA wants socialized medicine, then they should say it. And guess what? 90% of the doctors won't be a member anymore because most doctors don't believe in socialized medicine. It's not good for quality of care. You talk to people in Canada, you talk to people in Britain, and when especially you have something major wrong with you, things get delayed, and people are worried, oh, well, they're just going to let me kind of rot in a nursing home. And believe it or not, that does happen a lot in socialized medicine because you're put on a list and you're not a priority. And that's, I don't think our citizens of this country want that. Now, we have to make an adjustment for why a middle-class person can't afford insurance, that works hard and got to pay 15% of their salary for premiums and deductibles. It is a concern. So, start asking your doctors, especially if you have high deductibles and high premiums, about a concierge service, and you'll be surprised how much money you can save. I've been running the numbers for the last couple months and taking some of my patients, and I'm like, oh my gosh, if this patient went on this plan, depending on their deductible, they'll save anywhere from did one patient, they save $5,000 a year in deductibles and premiums. It's still covered.
If you're as confused as I am about all this,
Sorry.
or if you have a question you'd like to ask the doctor about any kind of health matter, you're welcome to call the live line 377-1244. We're on call with Dr. Michael Ulich, his monthly visit here to KASO Studios. Doctor, we're talking about the healthcare costs on a little bit different note. We are entering the end of the school year. Looks like warm weather is going to be here for sure now.
Yeah.
Health issues that go along with summer and getting out of school. And
getting out of school, obviously bug bites, snake bites, suntan lotion, dehydration. Kids are out now, and so safety is another thing. Their kids are running around more. It's lighter. It stays lighter at 7, 8 o'clock at night. Kids, it's the summertime, and this is more behavior, and you want to stay them up a little extra late, but really they still need their sleep. So if they normally go to bed 8, 9 o'clock on a school night, really 10 o'clock, don't say, oh, well, you can just stay up as late as you want because you don't have to go to school tomorrow. It's really not good and really teenagers do it the most, but even 7, 8, 9-year-olds, 10-year-olds, they're up till 11, 12 o'clock at night and sleep until 9 or 10 in the morning, and that's really not good for their well-being and health. You can do it every once in a while, you're at a late barbecue or something like that, but people don't realize how important structure is in sleep structure for especially growing younger children.
So it's kind of like you go off your clock. That's bad for you. And it's also tough trying to get back on the clock.
That's right.
When school starts back up.
When school starts back up, and we'll talk about that in the fall, but I usually say if you are off that schedule about a week or two before, to start getting into that routine again of going back to going to bed at a time that you normally send your child to bed during school, and then waking up at that time. That'll give them an adjustment also. Especially teenagers, they're awful with staying up at night, and it's hard to get them to go to bed. But what you do, how you get them to go to bed, is you wake them up. You wake them up in the morning, you get them out, and you get them to start doing chores. And so, maybe I should go to bed a little earlier tonight,
Yeah, a lot of parents working, they're gone
Yeah,
to work by the time the kid gets
that's
up,
true.
so they know what they're doing.
But the nice thing now, iPhones, the kids love iPhones,
Yeah.
but now you can spy on your kids a little, because
Yeah.
you can say, hey, let's FaceTime. What are you doing right now?
Right.
So technology can work, against, or say with teenagers, but it can also help parenting also if you know how to use it. One thing I wanted to talk about is vaping and e-cigarettes. That's a very, very hot topic right now. In New York, I know they're trying to actually get it regulated like regular tobacco cigarettes. So I was doing some research, and it shows that adolescent vaping is on the rise, and young adult vaping is on the rise. Now, they make all different types of nicotine concentrations, but there was a study done recently in California of about 2,000 adolescents, and they did, adolescents that didn't smoke at all, adolescents that smoked cigarettes, adolescents that smoked low nicotine vaping, and then higher nicotine vaping. And what they actually found was, obviously, the ones that didn't smoke had no issues, and they were less likely to start smoking, especially if they got to 15 or 16. But the real concerning was the low nicotine and the high nicotine vaping. The higher nicotine actually were 10 to 15 times more likely to continue and start smoking regular tobacco cigarettes. So people say, oh, well, they're cutting down. They're not. You don't get the nasty other smoke in there into tobacco. In actuality,
it's turned into a gateway drug.
Exactly. And so now I know in New York, because they're banning vaping from like what you would do with regular cigarettes. Can't smoke in public places. Can't smoke in anywhere inside where you can't smoke with tobacco cigarettes in Louisiana and New York. They're gonna probably put that law into place and then really regulate, which I think is great, because there's no long-term studies done, especially on children. Hasn't been around that long enough, and two, you're still nicotine. Unless you're smoking straight vapor, which most people don't, it's still nicotine, and it's just, and they make them fruity now.
Yeah, it's turned to a
I was thinking about when I was a teenager, not too long ago. Well, maybe now. Wait, I'm in my mid-40s. Yeah, it was a while ago.
You're gonna talk yourself into a corner here, Doc. You better.
I was thinking about it, and so I was a young adolescent, and what I found was, and I was thinking about smoking, is when I was a young adolescent. You 15, 16, you try a beer here and there. I really didn't like it. So you know what I used to drink a little? Once in a while? It's a wine cooler. Mm-hmm. And that wine cooler, then all of a sudden you would have a beer. So that vaping, in my own personal experience is kind of like that. You got this sweet strawberry flavored blah, 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 and it's good. And you say, all right, well, now I'm going to go to tobacco cigarettes. And I kind of really think it's that same way, like you talked about a gateway medicine.
And just one thing, it is technically against the law if you're under 18 to vape.
Yes.
You're not supposed to be vaping
right.
if you're under 18, just like
Is it 18 or 21? Is 18?
I'm thinking 18 because it was cigarettes was the same thing.
Okay.
Anyway, I know it's against the law. Okay, well, we got a caller on the line. Let's head to the live line this morning. Good morning. Thank you for calling, and you're on the air with Dr. Ulich. Go right ahead.
Good morning, Jesse. I just wanted to say great show. Good morning, Dr. Ulich. Excellent show. Excellent job. I'm sure you guys are probably getting the northern accent. It's your brother, Rob.
Yeah.
Dr. Ulich, I just want to ask you a question. How does a family member go about looking into this concierge service, getting more information? How would you do that?
If you're a patient of mine and I don't see adults, what I would usually do is you would get me, if your children come see me, you give me your plan, and I can call the insurance company and find out, what a catastrophic insurance costs, maybe just for the children, or if you can get, I'm trying to work with some family practice doctors in town to say, hey, you take care of the parents, I got the babies, I got the kids. Let everyone get on catastrophic insurance so we can get that deductible or that premium down, from $1,500 a month if they're paying full to, $300 or $400 a month, and going to save, in general, the whole, on everyone, anywhere from $5,000 to $10,000, $8,000 a year in premiums and deductibles. So, you can call my office, and like I said, if there's any family doctors out there, I love to partner with you, even if it's in Bossier. If you say you use your doctor's office in Bossier for you, but you use the kids here in Minden. So I'm really calling around to the doctor's office, trying to get a partnership going with some of the adult doctors so we can get the whole family. But if you don't want to do that, you can break your children off into these other plans, and then I can help you come up with a plan to show you here's your cost savings for the year. This would be worst case scenario, what it cost you, and this would be best case scenario, and go from there.
Does that answer your question, sir?
Yes, it did. Thank you very much. Just a quick thing. Mike, love you as always. Happy anniversary, 50th anniversary to Mom and Dad. And we hope to talk to and see you guys soon. Love you.
Thank you for calling, sir. Appreciate it.
All right, Jeff.
All right.
Thank you.
All righty. You're on call with Dr. Michael Ulich here at AM 1240 KASO. We've got about 4 minutes of airtime left, so if you want to call, ask a health-related question, it doesn't have to be about the health care cost or the bill. Just a question, I got this bump on my ear. What is it? Whatever it is, call us 377-1244. Well, we got time. I know we talk about billing and health care costs. We're talking about mainly treating diseases and injuries and that sort of thing. What about the psychiatric care side of all this? Is the process the same if a kid goes to a psychologist or gets a psych eval? And that's an expensive process.
It's an expensive and it's limited. And actually, it's probably 10 times harder. Really? Especially inpatient or long-term care, meaning long-term care anywhere for 3 to 6 weeks. I have, obviously I can't mention this patient's name, but I've been in and out of Brentwood 4 or 5 times in the last 6 months, and I cannot get, and this patient does, and by the psychiatrist at Brentwood, needs long-term care, 3 to 6 months, cannot do it. You know what the insurance company said? Well, she's not a danger yet. Well, she's done multiple dangerous stuff, and the only way is if she winds up in the ICU or hurting herself or hurting someone else severely. And this is where we're headed. And this is and here's a person that if we get good psychiatric care now, we can get her right so she won't be on the system and won't be one of these indigent person. And that is the worst. If you need psychiatric care and you're on private insurance and also Medicaid, it is very, very difficult to get, and it's really hard. Two reasons. One, the insurances don't want to pay for it, and two, the reimbursements to the doctors for psychiatrists are very, very limited, even limited than pediatrics, which is one of the lower ones that we get reimbursed for as far as in medicine. Psychiatry is even, and it takes actually more time. Takes me 5 or 10 minutes for an ear infection, 45 minutes to an hour for therapy, counseling maybe for the family, and it pays less than a 10-minute ear infection. And it's awful, and it's really, really hard for children and adults to get good psychiatric care because there's really not much out there, and for both of those reasons, as far as reimbursements, and no one wants to really do it.
I've been told the Medicaid paperwork is just awful. It's almost they're discouraged to even do it.
Yeah.
But anyway, we got about a minute and a half left, Doc. As we start to wind up this version of On Call with Dr. Ulich, anything you want to do to wrap up our show on this Thursday morning?
Yeah. One thing the cash people, you'll be surprised if you have to get a lab or an MRI or a CAT scan. You go to your doctors and you pay the money for that. Shop around. Call the hospital. Ask, because I've done it in this area, and I'm not going to mention hospitals, but one hospital, let's just say for a CAT scan, $1,500 if you had to pay cash. You go to another hospital, same CAT scan, same exact thing, $300. It's not $1,500 and $1,400 or $1,600. No, you're talking a third of the cost, and that's why if you have cash and it's not obviously an emergency, Shop around, call. Don't be afraid to ask. As soon as you walk in the doctor's office, what is this going to cost me? And if you have to get some labs, I want to know, because you will get that bill, and it's not going to be pretty. But you can negotiate, especially if you do it up front.
Maybe it should be like, you walk into a mechanic, this is much for this much, CAT scan is this, and X-ray is this.
Yeah.
So
and actually,
that
in
way
my
you know.
office, we're going to be doing that in the next 6 months.